Thank you, Minister. Member for New Westminster.
Thank you, Honourable Speaker, and on behalf of the official opposition, I want to say ditto to everything the Minister of Health said today. All of us who work in public service, all of us who aspire to community service, hope to make a difference, some small difference in people's lives. But very few can say, as Dr. Julio Montaner can say, and that we can proudly share in saying, that because of his work, literally tens of millions of people's lives have been saved, not just in Canada, but around the world. So it's very rare that this House rises as one to salute someone, but Dr. Julio Montaner is certainly one of those rare individuals who deserve it. I understand from reading a profile of Dr. Montaner just a few months ago that some of his early work was inspired by his father in his native Argentina, Dr. Julio Gonzalez Montaner, who treated people with tuberculosis, and and advised his son, I gather, in treating a stubborn respiratory disease, that he shouldn't just use one respiratory drug, that he should use several, and that's something that Dr. Montaner took forward in his early work. With HIV/AIDS, working at St. Paul's Hospital, treating people who came with what was then an unknown disease in British Columbia and Canada and around the world, and was later understood to be a particular type of pneumonia that came from HIV/AIDS, and eventually, as a result of that work, it became to be recognized. Years later, Dr. Montaner built on that earlier work and innovated several new treatments, which, as the Minister of Health has explained, a triple therapy became the standard of care around the world, Honourable Speaker, and what was once known as a death disease, as a death sentence, the incidence of this disease plummeted by 90% around the world. So it truly is the case that because of that work that Dr. Montaner has done with his colleagues and the brilliant work that he's now carrying out at a national and at an international level to treat the infection and to prevent the spread of HIV/AIDS, that truly tens of millions more lives will be saved in this country and around the world. He is truly a great British Columbian, a great Canadian, and we are honored and humbled by his presence in this House today. Thank you to Dr. Julio Montaner.